So it is now my pleasure to introduce Dr. Lesley Bennett. Dr. Bennett is the Deputy Director General, Clinical Excellence Division at the Department of Health. Before joining the department, Dr. Bennett held the position of Executive Director at the Royal Perth Bentley Group at East Metropolitan Health Service. Dr. Bennett is a practicing physician and is recognised for her leadership in clinical governance, safety and quality, workforce wellbeing and service transformation. Please join me in welcoming Dr. Bennett.
Thank you, Tina, for that warm welcome. And good morning, everyone. And thank you, Aaliyah, for that very personal and fascinating welcome to country. And I would also like to acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of the land on which we meet, and to pay respects to elders past and present, and to acknowledge a continuing connection to land, sea and community, and the importance of listening to voices that have for too long gone unheard. So thank you to Care Opinion for Australia for bringing us together as part of Patient Awareness Week and for inviting me to speak here at such an important milestone. 10 years of listening, learning and improving together. And thank you to everyone here for your ongoing commitment, your time, your care and the energy to hearing and responding to voices of patients, carers and communities. I stepped into this role from my role in East Metro in January this year. And one of the strongest personal commitments I brought with me was the belief that the health system only improves when we genuinely listen to the people it exists to serve. Clinical evidence is not only about evidence-based pathways, about protocols, about metrics. It's really about understanding what it feels like to receive care, to navigate our systems when you're feeling frightened and vulnerable, either as a patient or as a relative or caring for someone that you love. And that belief has shaped one of the early priorities for my division, building a culture that truly hears and acts on the patient, carer and family voice. In March, we began rolling out What Matters to You work across WA Health. At its heart, it's very simple. Instead of asking what's the matter with you, we encourage clinicians and carers and other staff to ask what matters to you. That is a transformative conversation, and it turns the question around for people to answer, if we listen, around what they value, what they fear, what they hope for, and what good care actually looks like from their perspective. And as we know, and as we've heard today, it's different for different people. For some people, it's dignity. For others, it's cultural safety. For others, it's keeping their family close, being involved in their decisions. And for some, it's simply being heard. These conversations are only the beginning. The real value comes when we keep listening across all aspects of our health system, not just within WA Health, but outside. And that's where Care Opinion plays such a powerful role. So I was pleased the Minister mentioned today one of the portfolios in the Sustainable Health Review that I now sponsor, which really is around the importance of community partnerships in the design, delivery and the evaluation of healthcare services. And we know this is a direction that we need to move in WA Health, not just for health to be financially sustainable, but for our outcomes to improve and to deliver care that our patients want. It's not optional work, it's foundational to a sustainable, equitable health system. We've heard a lot of times today that WA Health exists to serve every Western Australian every day. And the only way that we can do that well is by actively learning from the lived experience of people who use our services. We also know we have a lot of variation at the moment in access and in outcomes in our healthcare system. So we have quite a bit of work to do. We also know from good evidence now, and I will use some stories or some data from NHS Scotland. So NHS Scotland rolled out What Matters to You, and they have shown consistently that outcomes improve for patients. So falls in the aged care ward reduced by 50%, their complaints reduced dramatically. We know that resources are used more effectively and services are much more relevant to what the community wants. We have to remember that listening well is also critically important for people who have historically been missed or marginalised. And in WA, I know we are all aware of our responsibility to engage meaningfully with Aboriginal people, people living with disability, culturally and linguistically diverse communities, and people who identify as LGBTQIA+. And we know that true engagement is not one size fits all. It requires culturally safe approaches, accessible feedback pathways, and a genuine willingness to hear feedback that may be uncomfortable but necessary. And feedback is not about a complaint system, it's about whole system learning. We know that when people hear that they're doing well, it matters deeply, particularly in a highly pressurized environment. And we also know that when people tell us where care fell short, we have an opportunity for improvement. Care opinion is one of the many ways in which people can share feedback, and we have to be respectful that people have different ways that they want to feedback. There is communication with staff. We have our liaison services. We have surveys. Some people want to write emails. Some of the older generation, as I'm sure you've seen, like to write 3-page letters in handwriting. And I think it's really important that all avenues are available to people. But platforms like Care Opinion are really important, and the anonymous component provides something unique. So Care Opinion has now been part of the WA Health journey for a decade. And as we heard, it was first introduced here in 2016, and it was endorsed through the Sustainable Health Review to become a real trusted and transparent way for people to share their experiences publicly, and also for services to respond openly and thoughtfully. And we've heard the word transparency a lot today, and that public exchange matters. Transparency builds trust, it demonstrates accountability to us as healthcare providers, and it shows that as a system we are willing to listen and act. And the stories that raise challenges are equally valuable as those that celebrate extraordinary care. So what next? So this forum has been a bit about reflection on the last 10 years. But for us, as we celebrate 10 years of being in this space and for being a system that is committed to becoming more person-centered, we need to ask ourselves, how do we deepen that impact? I'm talking to a room of the converted. How do we get the engagement deeper? How do we really get the culture of the importance of listening to patients across our organisations? That's our roles, and we have to think about how we do that as leaders. How do we then align that with system priorities? How do we pull that together? And the reality is, how do we create a business case for government to invest in this area? We have to be able to demonstrate value. There has to be something that Treasury is going to commit to. And how do we continue to empower consumers and carers to partner in our improvement? How do we enable them? How do we make them comfortable in our space so that we are hearing them and providing them the right platform to educate us? I'll finish where I started. Healthcare is at its best when consumer, carer and community perspectives sit at the centre, not at the margins. And feedback is not an add-on, it's essential to safety, quality and sustainability. So as we mark 10 years of listening, I invite all of us as leaders, clinicians, advocates and partners to keep asking, what matters to the people that we serve and how are we responding? Thank you, and I look forward to the conversations ahead.